All right, so dry needling the piriformis. First thing we want to do is get them prone, get them comfortable. They can have a pillow underneath, whatever feels good to them, pillow underneath the legs, and then that whole glute area is going to need to be exposed. And then what I like to do is just kind of take a towel and just cover up everything else we're not working on. And the first thing we're going to want to do is palpate and find S2 to S4, which should be where the piriformis is. I'm going to take my thumb and I'm going to go right on the edge of that sacrum, right on the border, and that's going to be my first needle. I'm probably going to use a 50 or a 60 millimeter, and I'm going to go straight down onto that until I hit bone. That is my test needle. That is my marker, so I can see how far I can go with the subsequent ones. So then from there, from the test needle, I'm then going to come down to the proximal third of the piriformis. We're gonna go straight P to A. Now we're not gonna have a bony backdrop. And so I'm looking at the test needle, and what that tells me is that I can go probably about 20 millimeters deeper before I hit sciatic nerve. Not the end of the world if you hit the nerve. Sometimes we do that on purpose for perineural needling, but all I would do is I would just go slow, so that way in case he gets a little zing down his leg, you can always just retract it a little bit and then leave it in. Then the middle third, so I'm coming on down, middle third, same thing, right? We want to go the same depth as what we did for the proximal third, or if you need to look back at that test needle, straight P to A. And middle here, it can be right in the center, or it can be where the patient's familiar pain is, whatever it is. We'll come down, go slow. You could hit sciatic nerve, so just keep in mind it runs underneath that area or through it in some people. Leave it there. Distal third, we just find the posterior aspect of the greater trochanter. We just go straight P to A until we hit bone. We can stem all four of those or stem a couple. I would suggest 2 hertz times 10 minutes for that. The other thing too is if it looked like it was piriformis, but it turns out maybe it was like gemellis or obturator, you could always just kind of follow the same concept and just come down, go slow with it until you hit that trigger point. These are also ones I do like to wind and twist to get that tenting effect before I hook up the stem. And otherwise, that's pretty much it.